your own YouTube channel, Ask Your Gynecologist. I'm Dr. Sonal Parihar. As usual, I've come back with a topic which has been suggested by you people, and some topics which I feel are very important to be discussed, which I feel in day-to-day life that patients need to be aware of this. So I always select such topics, right? So today we are going to talk about post-pregnancy changes in the body shaming which you feel, and little bit things about depression and breastfeeding, all those things which you should actually know, the basic things, basic knowledge about these things, right? So before I start, I would just thank you all for the way you all are responding to my channel. I go live every day and answer all your questions. I try and answer all your questions. Then DocWise app is working very well. It has started in internationally as well for the international patients. And one thing I would like to request, some patients are sending me pictures of their private parts, that I've got this problem in the vagina, my vagina is loose, or I've got soreness there, or I've got some reaction there. Now, it is not possible to treat such patients on DocWise app, because unless I see you personally, it is not a skin problem that you're clicking a picture and showing it to me. It is something internal, and it has to be examined internally with the help of instruments. So do not waste your money on DocWise app in case you think that it cannot be dealt without showing the part to the doctor. Because I can only deal with patients who have reports, who have some complaints, who have like hormonal problems. Then I can advise some tests and I can advise you some medicines. So do not waste your money and don't do this. Don't send pictures of your private parts, because it is not possible. I don't want to prescribe something which will harm you. Okay. Next is my pin on the DocWise app. In case you're watching my video for the first time, this is the pin and this is the technical number. You can always contact them. Then people who want to come to my hospital and show me personally, this is my address and the secretary's number. You can call her between 10 a.m. to 8 p.m. and get an appointment from me. Other than that, I've got Facebook portals, Instagram and Twitter. You can use that just in case you're not very comfortable with YouTube. Other than this, I've got other portals like Facebook portals, Facebook pages, Instagram, Twitter. I give you this so that just in case some patients, they're not very comfortable with YouTube and your questions get lost there, they can always message me here. If I feel that your question can be answered there and there, I will. Or otherwise, I will note it down and answer it in the live session that I do every day on the YouTube. Otherwise, if I think it's too personal and you're sending all your reports to me, I will request you to come on DocWise app. Right? So this is how we deal every day. Now coming back to the topic, post-pregnancy changes in the body. Now we all know that we all get fat. Now this particular topic is for patients, for women who have been pregnant or who are pregnant right now. So you feel that after delivery, suddenly your tummy has gone very loose and you feel that probably the baby is still inside, and you'll ask your doctor, what have you done? The baby is still inside or what? I still feel 6 months pregnant. And even if you don't feel so, people will make you feel that. Your relatives, your friends, everybody will say, oh my God, what has the doctor done? Ask her to give you some medicine. Did she not conduct the delivery properly? Why are you still looking pregnant? Now that is normal, please. Just imagine there is a big jute bag and you put lots of things inside it and store it for some time, and then you suddenly empty that jute bag. Do you think it will again come back to the normal shape that it was initially when you bought it from the market? No, because the fibers of the jute have separated. They become loose. Now they cannot be tightened. This is what happens to your tummy. When the baby is inside, the placenta is inside, lots of fluid is inside, your tummy stretches like this. So that is why you develop all those stretch marks and lean and nigra and all that. And then you suddenly give out everything comes out, and you feel that your tummy has to go tight and flat as before. It will not be possible. Okay, it will take at least 5 to 6 months to come back to its normal shape. It all depends upon what was your pre-pregnancy weight, what amount of weight you have gained during this pregnancy, whether this was your first pregnancy or second or third, how much exercise you are doing post-pregnancy, how active you are you breastfeeding or not, plus your genetic characters. We cannot change the genetic characters. So in case you have the genetic characters of getting fat or having a flabby tummy, then we cannot help it out. But these are certain factors which will decide how far and how soon you will come back to your normal shape. Make it a point, if this was your first pregnancy and you are an active lady, during pregnancy also and after pregnancy also you are active, you are exercising and you are breastfeeding, it will be very easy to come back to your normal shape. Okay? So please do not think that you're looking ugly. It is okay. It will take around 5 to 6 months and you'll be back to normal. Plus, your body also starts secreting a lot of fluid from everywhere. Like for example, sweating. Your glands have swollen up. Your cervix and vaginal glands, they have swollen up. That is why you discharge a lot of white discharge during pregnancy. Even after pregnancy is over, for about a month, you keep on discharging, say initially red colored blood, then comes yellow, then white. We call it lochia rubra, lochia alba, lochia another thing. So these are different names of the discharge that you pass through the vagina. Then you might even start, as I said, sweating a lot. Then your breast swells up because it has to secrete milk. So the entire body is swelling up. All the cells have swollen up. Give it some time, it will come back to its normal shape, right? Next, coming to the stretch marks and the linear nigra. Now, if you have watched my earlier videos, from in the very beginning when I just started the channel, there is a video called Common Problems in Married Ladies. Right? If you watch that video, I'm sitting with Sonal Parihar and we are talking about the common problems of married ladies. We have discussed this in detail. What is linear nigra and what are stretch marks and why do they develop? Okay, so just repeating it again. Stretch marks develop because your skin just stretches like this. So the elastic tissue and the collagen tissue, the fibers, they break, and once they are broken, these white patches they develop. So stretch marks, they develop more in a lady who is thinner and goes fat, this much fat. A fat lady, a lady who has some fat on the skin, who does not have a dry skin, who has an oily skin, she has more elastic tissue. So when it stretches, she has a capacity of stretching a lot. A thin lady with especially a drier skin, it undergoes a lot of stretching, then she will develop more stretch marks. So it really depends what kind of skin you have, what was your weight pre-pregnancy. Okay, so just try and make your skin as healthy as possible. Put lots of oil, aloe vera, very nice creamy creams, because none of these creams will get rid of the stretch marks. They will just kind of help you in not developing a lot of stretch marks. And do not scratch yourself. You will have a lot of itching. Do not use your nails to scratch yourself, because those marks are permanent. Like I said, stretch marks are permanent, only the color will fade away. A dark lady will have blackish or dark brownish stretch marks during pregnancy, which fade off after say 6 months. If you look at your stretch marks, they will look light brown. Similarly, a fair lady will have pinkish, very dark pinkish or reddish stretch marks, which after delivery within 6 months, they will become very light pink or whitish. Okay, so you can just prevent them by taking care of your skin and taking care of the weight gain that you are going through. Linear nigra is a blackish line which develops and becomes more prominent during pregnancy. It develops from the umbilicus till the pubic symphysis, till the end of your pelvic area, right? So this is as I said before in the previous videos, it is a line which develops because the muscle fibers from the right and the left side, they join together, and that is called the raphe, the muscular raphe. It undergoes stretching because of the skin stretching, and that is why, because of the hormonal effects, it becomes dark, and after the pregnancy is over, the darkness and the prominence goes down, but it still stays there. Okay, so these are the two things that you should not be ashamed of. Every celebrity who has delivered a baby will have stretch marks. Don't worry. They cover it up with makeup. So just don't worry. It is okay. It is a mark. It is an indication that you have delivered. Okay, so don't you worry about these stretch marks and linear nigra. Next most important thing is how to breastfeed. Now, breastfeed, I'm not going to teach you how to breastfeed. I'm just telling you little bit tips. I feel very bad in the OPD when I see young patients, especially the ones who have delivered for the first time. They come with big breast abscesses, pus filled inside the breasts. Now, why does this happen? This happens because they don't know the technique of breastfeeding. Make sure that whenever you're breastfeeding, sit up. Do not try and lie down and put the baby to breast, because then the baby has a tendency to cut. The baby might not have teeth for the initial 4, 5 or 6 months, or even after that. Sometimes the babies, they take time to develop teeth, but their gums are very strong to give you a bite. So unless you put a proper area of breast, including the nipple as well as the blackish area, the areola, inside the baby's mouth, the baby will not be satisfied and he will not get proper milk, because the glands, the ducts will not go inside his mouth. Then it will cut you, and once the skin is cut, the infection goes in and you develop a lot of pus inside. And that breast, for that particular baby, will not be of any use, because you will not be able to breastfeed with that breast. You will be too scared, or probably that breast will not produce any milk in this pregnancy. It may or may not work in the next pregnancy. Okay, so just be careful with the breastfeeding technique, and ask your mom, ask your relatives who have already delivered and breastfed the babies, or ask your doctor to help you out in that. Okay, Last but not the least, the post-pregnancy blues. You really need to know about this, and your relatives, they need to know about it. Every lady after delivery, whether it's a cesarean or a normal delivery, has a lot of pain in the stitches. Even if you don't have stitches, say it was your third or fourth baby, a normal delivery, even without the stitches, you have that tendency of going under depression because you're going through that postpartum hormonal changes. You have to take care of your baby, a newborn baby who is probably not letting you sleep the whole day. You have to take care of the other household members. Oh, okay, you're not taking care of them, they are taking care of you. But then you've got all those pregnancy changes going inside you, body shaming, then your breast is paining because you're breastfeeding, your stitches are paining, you're not feeling okay, you're not able to sleep properly because of your newborn baby. The baby is also trying to adjust with you. So all these things the family members and the partner need to know, and they need to give you full support. Unless you get tender love and care, the TLC is very important for a postpartum lady. Unless you get this, you will not be able to overcome all these things, and sometimes I've seen patients becoming psychotic or developing mental disorders because of this. So please be aware of this, that it is normal. You will have depression, you will have a tendency of crying because you're going through a lot of changes in your body. Okay, so it will take some time. If the people are caring, people around you are caring, you will definitely sail through smoothly. Okay, so I'll be back again with the next video in which we will be discussing what to eat, nutritious diet which will not give you fat but give you strength, and what kind of exercises you can do to bring your body back into shape. Okay, so till then, take care, keep subscribing to my channel, keep liking them, keep sharing them. Right, take care, bye bye.